Hello everyone, my name is Dr. Aajay Shah. I work for Oaklawn Hospital in Marshall, Michigan. I'm their full-time cardiologist. We've been recording these videos not just to educate my own patients, but to educate the community in terms of preventing and reversing the heart disease. Today we're going to talk about what happens to you and what is our role as a cardiologist in my office after a heart attack or a stent or any heart procedure. So let's talk about what happens to you. Many patients, when they come and see me, or if they have gone through emergency room and they have had a heart catheterization or a stent procedure or a bypass procedure, they come and see me after those events, after something has happened to them. They are scared. They are many times without confidence. They feel like this is end of their life, end of their story. The family is scared. And I obviously fully appreciate that. I'm fully sensitive to that. Matter of fact, I'm really responsible in terms of holding their hand, giving them assurance, giving them confidence that it will be fine. So let's talk about what we do in my practice, what I do when I see a patient or a person who just had an event or just had a heart attack or a stent or a bypass surgery. Once you have any of that, once you come and see me, first thing we will do is we'll make sure that you are on proper medications. Proper medications is very critical. Knowing each and every medication you take, why do you take it, how you take it, what dose you take it, what are the side effects, how you call us in case if you develop the side effects. To give you an example, after a stent procedure where we put a small coil in your heart, taking 2 blood thinners is very critical. And by mistake or because of side effect, if a patient stops one of the blood thinner, the stent can clot and can cause an instant life-threatening heart attack. So it's very important that patients do not stop their blood thinner for 1 year. So this kind of simple education becomes very critical. So I tell all my patients that every medication you're on, understand them, know them, how long you will be taking them, what are the side effects, and reach out to me if they develop side effects. Once they know the medications, the next thing is how we can reverse and prevent the future heart attacks and strokes. Cardiac rehab is one of the method where we know that heart disease can be reversed. We do cardiac rehab at Oaklawn Hospital. Insurance covers it after a stent, after a heart attack. Cardiac rehab is one of the major reason heart patients have done well. Our cardiac rehab department at Oaklawn Hospital is not only very equipped, but one of the best programs I've ever seen in the last 25 years of my practice. The staff at cardiac rehab is excellent. We have excellent equipment. You typically come for 1 hour, 3 to 4 times a week. They put you on a different exercise machine. They educate you on diet, stress reduction, medications, and you become a learner patient. I highly recommend, and most of my patients get cardiac rehab. Obviously, sometimes cardiac rehab is not possible because of distance and because of work commitment. Then I guide them to how to do cardiac rehab at home. The other thing I tell patients is that now, once the event has happened, their role to prevent the future events becomes more critical. Regular exercise program at home, 20 to 30 minutes, 4 to 5 times a week. Proper diet, including plant-based food, is very critical. Lowering saturated fat is very critical. If you smoke, you absolutely have to quit smoking. You absolutely have to quit smoking. Stress reduction is very important. Performing some kind of meditation once or twice a day, learning how to cope with the stress is very important. Having proper sleep, at least 6 to 7 hours a night, is very critical. We are all addicted to our phone, our devices, our iPads. Lowering those media time is also very critical. I think, to me, having an event should be taken as a wake-up call. And I tell my patients that if we do things right, you will have only one wake-up call and you will live not only a healthy life, you probably will live a long life. Because to me, having that wake-up call, and if you survive the event, you only have high chance of defeating that disease, defeating that heart blockage, and never get in trouble again. Obviously, this will require a lot of commitment, a lot of hard work. It's not easy. There's nothing easy in life. But if we do it together, we can do it. Call our office. I'm always available. Anytime you have any concerns or questions, do not get scared. Your family also can help you to take care of your overall well-being. And many times when a person actually starts doing the right thing, whole family benefits, whole family gets healthier, and matter of fact, they actually end up having side benefits of somebody else going through a health scare. So let's do it together. Call our office if you need to. Thank you.